Hey there, Erica Torres Duziak here, looking like a hot mess, but it is 4 weeks today since my explant, and I'm doing one of my favorite things I love to do, which is walking, being outside, and I just wanted to update on a couple things. So through reflecting, I definitely noticed that after explant, after the first few days, I was feeling really good. And I started ramping up my exercise, my walking over the past couple weeks and overdid it. Before surgery, I was probably averaging between, 50 and 65,000 steps a week. And last week I got to 90, and the week before it was like 88. And so definitely ramp that up. And although that might sound awesome and great and amazing because my energy levels have been amazing, I have experienced some adrenal crashes. So that was the sign. Doing a little bit too much too soon. And I had a follow-up doctor's appointment, not for my explants, but for my other health issues. And he reminded me that after explant, many of his patients feel amazing, especially after like the 1 year mark, maybe not quite back to 100% normal after the 1 month mark. So, reminder to me, reminder to you that even though we might feel amazing, after explant, we just had surgery, we probably have other health issues, and so trying to push it. Again, I wasn't even running. I'm not, of course, doing strength training, but I think that along with the intermittent fasting and the low carb probably was a little bit too much. The other thing I wanted to share that I had learned through this, I'm not really keto, but I'm definitely on a low carb, kind of modified keto, but I don't like counting all that stuff, and I don't want to get into all of that. But I started noticing a lot of irritability and just more crashes in the past week and a half. And after talking with the doctor about it, I realized that I was a Stevia addict. Have you heard of that? After I started adding a lot of those fat bombs and, keto brownies, I really got addicted to all of that sweet flavor. And even though you're not eating sugar, you're not giving your body sugar, but then you're putting stevia. And I don't just do it in moderation, right? I do a lot. And so I'm adding all this sweet stuff that's registering to my brain, yummy, sweet. My body's probably releasing insulin, and I get this dopamine hit. And so then, of course, I feel fine when I'm drinking it or eating it, and then in between, I'm just getting really irritable. And so it was brought to my attention that because I'm not putting in any sugar in my body and I'm getting these dopamine hits, I was getting really addicted to that stevia and erythritol and all other not so great stuff. And so I'm not going to say I'm excited about it, nor am I going to promise that I'm going to go cold turkey, but I did learn that stevia also can affect, I guess, the way it's eliminated through whatever methylation pathways, if I'm even saying that right, excuse me if I'm not, something like that. That for my particular genetics and mutations, that particular one, stevia, has a little bit more trouble. So I'm wondering if that's also contributing to my crashes. So I'm going to pay more attention this week and probably not hit 90,000 steps for a while. Maybe keep it to maybe 70,000 a week, and really minimize any kind of sweetness and kind of determine my mood. I will say that I'm feeling a little happier and better today. I had some monk fruit in my decaf coffee this afternoon and a little bit of stevia, but like nowhere near what I would do. So just wanted to share with y'all, if you are potentially doing keto and have had a sugar addiction in the past, that is possible even when you're on keto. And who knew that stevia could be addicting and could have an impact on your body and how you're feeling. So wanted to give a quick update. I'm at 4 weeks. My follow-up appointment is later this week. And I also wanted to mention that my blood work came back and my thyroid improved a bit, and that was with me even decreasing my thyroid. And my white blood cell count improved a bit, so it was cool to see some of those numbers get better, just like me doing nothing but taking out my implant. So that was pretty cool. All right, well, appreciate you following me through this journey. I'm hoping that it's helpful to you, and I will connect back when I have some more juicy stuff to share.